Introduction to Medical Marijuana. Hello, this presentation is brought to you by Dr. Siddiqui of Medical Cannabis Clinics. Dr. Siddiqui is a board-certified neurologist and neuropsychiatrist. Cannabis and marijuana are interchangeable terms. Medical marijuana is legal in Florida since 2016 for many medical conditions, such as PTSD, chronic pain, Parkinson's disease, multiple sclerosis, Lou Gehrig's disease, or ALS, HIV, and cancer. As you can tell, the vast majority of these conditions are neurological or psychiatric, and it is a shame that not many neurologists or psychiatrists have started to utilize the power of medical marijuana in their clinical practices. The process of obtaining medical marijuana recommendation involves seeing a doctor who has completed the state-mandated training to recommend medical marijuana for you. The doctor will review your medical history and perform a pertinent physical exam to ascertain that you suffer from a condition that is approved in Florida for the purposes of recommendation of medical marijuana. It is also the doctor's job to verify that you have been treated appropriately for your condition with the standard of care with allopathic medicine by a doctor or appropriate discipline before starting medical marijuana. The doctor should review your medications to avoid any conflicts with medical marijuana. The doctor is also required to check your controlled substance history on a special database to determine risk posed to your life by taking opiates and benzodiazepines such as Xanax. At this point, the doctor will explain to you the consent form required by the state to be signed before medical marijuana can be recommended for you. You have to acknowledge the risks and benefits and the current state of medical marijuana for the federal government. If the doctor feels you will be an appropriate candidate for medical marijuana, he will enter you into the registry of medical marijuana on the website of the Office of Medical Marijuana. This is a centralized process. 3 entities have access to this website: the doctor, the patient, and the dispensary where the patient obtains the medical marijuana. Hence, there is no paper to carry around. The doctor enters the patient's biographic information, such as name, phone number, date of birth, email, and social security number. This starts the process. After the doctor saves this information, you will receive 2 emails from the state of Florida, which will guide you to obtain a medical marijuana identification card from the state. The card is somewhat similar to your driver's license or a concealed weapons permit. The process involves reading the emails received, creating a profile with the login information provided, and then paying the state $75 processing fee for the card. You also have to upload a picture of your driver's license to verify your residence in the state of Florida. Then you wait 1 to 2 weeks, after which you receive an approval email. At this point, you are ready to proceed to a dispensary. Even before your physical card arrives in the mail, you should print the approval email and take your driver's license to the dispensary to verify your identity. The dispensary will dispense the medical marijuana to you as they can see firsthand that you are approved in the system of the state on the registry. It is always a good idea to call the dispensary and verify your status before making a long drive. You can also determine good and bad times to visit the dispensary to avoid excessive wait times. Also note, many dispensaries deliver directly to your home, some with no charge. What are the methods of intake and the amount of medical marijuana? This will be discussed at the time of your visit with the doctor. The methods of intake of medical marijuana include inhalation by a vaporizer, oral capsules and sublingual drops of tincture, skin creams, patches, and suppositories. The state also approved the actual flower for medical marijuana in March of 2019. The maximum allowed amount is 2.5 ounces for every 35 days. Keep in mind, 1 ounce is also 28.5 grams in the metric system. The flower is sold at the dispensary in 1/8 of an ounce, or 3.5 grams. The price varies a lot, but do expect to pay up to $350 per ounce. Marijuana is a plant with 120 compounds, or medicines, in it. The 2 we talk about the most are THC and CBD. We like to compare them to espresso and milk, respectively. Too much espresso in a cup without milk or cream, it will be bitter. Likewise, too much THC without CBD, and you will feel high. CBD balances THC. Just like milk makes espresso less bitter, the recommended ratio is 10 of CBD to 1 of THC. It could even be 20 to 1. As you gain more experience or tolerance, you could try 1 to 1. A golden principle in medical marijuana treatment is start low and go slow. You should stay on the same dose for 1 to 2 days before increasing it. Always start at 5 to 10 milligrams of whichever product you use and then gradually titrate upwards. You also need to know about THC types. They are sativa, hybrid, and indica. Let's compare sativa to regular coffee, hybrid to green tea, and indica to decaffeinated coffee. So sativa is stimulating, hybrid neutral, and indica is in the bed. It is good to know a few other names of compounds in marijuana besides THC and CBD. They are terpenes. These are oils that render different properties to marijuana, like color, smell, and other biologic activities. There are also CBG and CBC, which are being studied for cancer care. Where can you get more information about medical marijuana? Our website has a blog with the latest information. You can also buy a book called The Leafly Guide to Marijuana from Amazon for $20. If you are new to medical marijuana, this is a lot of information. Rome wasn't built in a day. Take your time, study, discuss, and visit many dispensaries and read reviews online. Pretty soon, you will get the hang of it. Weed Maps is a good website to find and research local dispensaries.